What are the potential long-term side effects of tsDMARDs for RA? Targeted synthetic disease-modifying antirheumatic drugs are powerful medicines used to treat rheumatoid arthritis by blocking specific parts of the immune system. They can help control symptoms and slow joint damage, but like all medications, they may have long-term effects. It's important to understand these so you can work closely with your healthcare provider. One of the main concerns with tsDMARDs is an increased risk of infections. Because these drugs suppress parts of the immune system, patients can become more vulnerable to common infections like colds and the flu. They can also make it easier for opportunistic infections to take hold, which are infections that usually don't affect healthy people. Regular monitoring and good hygiene practices can help reduce this risk. Another long-term concern is the potential increased risk of certain types of cancers. Some studies suggest that prolonged use of some tsDMARDs might be linked to a slightly higher chance of developing cancers, such as skin cancers or lymphomas. However, the overall risk varies depending on the specific medication and individual health factors. Healthcare providers carefully weigh these risks against the benefits when prescribing these drugs. Blood clots are another possible side effect. Some tsDMARDs have been associated with an increased risk of blood clots forming in veins or arteries, which can be serious. Symptoms like swelling, pain, or sudden chest pain should be reported immediately. Doctors often assess individual risk factors before starting therapy and monitor patients closely during treatment. While tsDMARDs are not directly linked to increased heart disease risk, rheumatoid arthritis itself is associated with higher cardiovascular risks. Managing inflammation effectively with these drugs can sometimes help reduce that risk, but patients should also focus on healthy lifestyle choices and regular checkups. Specific drugs like baricitinib and tofacitinib have their own side effect profiles. Baricitinib has been linked to serious infections, blood clots, and some cancers. Tofacitinib shares similar risks, including infections and cardiovascular issues in some cases. Your healthcare team will evaluate your health history to determine the safest options for you. To help manage these risks, doctors usually recommend regular blood tests and checkups. Screening for latent infections like tuberculosis before starting treatment is common. Patients may also need to avoid live vaccines during therapy to prevent infections. Maintaining good hygiene, avoiding contact with sick people, and promptly reporting any unusual symptoms are important steps. In summary, while targeted synthetic drugs can be highly effective for controlling rheumatoid arthritis, they do carry potential long-term side effects. These include increased risks of infections, certain cancers, and blood clots. It's essential to have open conversations with your healthcare provider, follow recommended monitoring protocols, and make lifestyle adjustments to stay as healthy as possible. Always remember, individual responses vary, so personalized medical advice is key to safe and effective treatment.